Hey there, Toby Stark Associates Insurance Agency. The day has come, the update for 2025 Medicare costs and premiums. And I want to special thanks to NABIP, the National Association of Benefit Insurance Professionals, for putting this together for us. This association, in which I'm a part of, helps lobby to make sure that legislators understand the issues with Medicare, and we work to lobby them to fix. Sometimes it takes years, but fix these issues for you. And sometimes we're working to fix things you may not even know about, but our job is to represent you as the beneficiary and look for pitfalls that you don't even know about, bring them to our legislators, and fix them. So without further ado, Part A, hospitalization. Now, these may seem odd, like I've never seen these before. Wait a minute, I don't ever pay a deductible in the hospital. $1,676 per benefit period, or coinsurance, or sharing the cost. Most of you, if you have a Medicare supplement policy or you have a Medicare Advantage plan, it covers these costs and you won't see them. If you're in a Medicare Advantage plan, you're paying a copay per day for your admittance. If you're lucky enough to enroll in a Medicare supplement, you leave the hospital paying nothing, $0. Skilled nursing facility, 3-day inpatient hospital stay required first. This is a hot button. Some of you may see that and be like, I don't understand what happened. I was in the hospital and I wasn't inpatient. I went to a facility, a nursing facility, to get better, and Medicare didn't pay. This is an issue that we continue to work on. So coinsurance will be $0 a day, and days 21 through 100 after the 1 through 20 are spent is $209.50 per day of each benefit period. Again, this comes into play if you're just on Medicare only, you don't have Advantage, or you don't have supplement. Part B, medical. Without further ado, the Part B deductible for 2025 is $257 per calendar year. In January, every year the deductible resets, and generally it's probably around this time we hear from Medicare what the upcoming year deductible will be. It is not static, and it definitely changes. In 2024, it was $240. In 2025, it's going to be $257, which is a little tick up, not a big deal. Part B coverage, you pay generally 20% after the $257 is met. So for most of you, if you're on an Advantage plan, it's generally an office visit or copay. If you're on a Medicare supplement, once you hit the $257, wash your hands. You don't owe anything, $0 after that. Medicare Part B premium, and those enrolled in Part B will pay at least the standard $185 a month premium based on income. Aha! This year, meaning this 2024, it was $174.60 a month for this standard base Medicare premium. It's going up to $185. Some years the premium stays flat. In a year it went down. Here it's going up a little bit to $185 for 2025. If you already are paying your Medicare through Social Security and it's getting withheld from your Social Security check, there's no action to be taken. They'll automatically adjust it. If you are getting your account debited at mymedicare.gov, they'll just change the debit amount. And if you're paying quarterly, sending a check to the government, they'll just adjust and you'll continue that way. So this is the Modified Adjusted Gross Income, or MAGI. And what is this chart? This chart is for higher income earners who are enrolled in Part D prescription drug coverage and also pay Part D IRMA in addition to the monthly insurance premium for Part D. So if you are a higher earner, you will have to pay more for your Medicare Part B premium and more for your Medicare Part D premium. And this will be collected, this additional monies will be collected directly from Medicare. For 2025, they look back to your 2023 tax return, and if you are making less than $106,000 in your individual tax return, or your joint tax return is $212,000 or less, it is $185 a month, and that is the base Medicare Part B premium. And there is no additional premium that you have to pay the federal government for your drug plan standalone. But as you get higher, in your 2023 tax return, they will start, as you can see here with the hand going down, increasing your premium accordingly. $74 additionally, $185, $295, and so on top of your base premium. This would be your total premium, the $259, $370, and so on. Also, they would start adding additional premium to your standalone drug plan. So not only would you be responsible for paying for your Part B, but you would also be paying for IRMA additionally. There is no better benefit. It's not because you're paying more, you're getting a better benefit. This is how the government decides what your premium is going to be based upon Medicare. And then also in Part D and the drug plans, they will increase accordingly as you make more. And this is on top of your premium that you pay. So if your drug plan premium is $50, you're going to pay the insurance carrier $50, and you're going to be in charge of paying Medicare the additional $13.70 and so on. If you disagree in 2025 and you say, wait a minute, I'm retired now, I had a life event, you do have the opportunity to appeal and send a form directly to Social Security. I urge you to do that. So many people had a life event and they continued to pay the higher premium throughout the year when if they sent in the right appeal form and tax information, the government may grant them a reduction in premium. I mean, they're just keeping the money, right? They're not going to give it back to you if you don't appeal. So definitely appeal. And it's based upon your 2023 MAGI, or Modified Adjusted Gross Income. It's Form 1040, line 11, plus the tax-exempt interest from Form 1040, line 2A. Disclaimer, I'm not an accountant. I'm just reading this. All right, so this is 2025. Have a great holiday season. Toby Stark Associates, happy to help you. This isn't terrible news. Little bit of an increase. Take care.